Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. We're taking your calls right here in the studio at 866-870-5752. And you do get a free book when you call. That book is called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has over 250 scientific studies. So when you call the show today, you do get that for free. Again, that number is 866-870-5752. And right now, we were just on the air with Janet. Are you there, Janet? I think she dropped. So, Janet, give us a call back, and we'll pick you right up. In the meantime, Dr. Darrow, do you want to go to our next caller?
Yeah, we're going to go to Michael.
Sure.
Hey, Michael, are you there with us? It's Dr. Marc Darrow.
Yes, Dr. Darrow, I'm here, and it's a great honor to be speaking with you.
Oh, that's so sweet. You too. Thank you so much for calling in. I'm going to repeat what the call screener wrote down for you when you called in. Have you ever used stem cell on a male hernia? You used to carry a heavy bucket for your job, and the answer is I treat sports hernias all the time. The sports hernia is where the adductor muscle attaches to the pubic bone. So that's a different type of hernia than a hernia that I think you're talking about that you might need surgery for. Do you know which type it is that you have?
You would be probably familiar with the medical term, and it starts.
Well, the term is generally inguinal hernia for most hernias.
That's the one I have.
Okay, the one I can help you with is different.
Okay.
The one I can help you with is more of a sports injury or a yoga injury or something like that, where you stretch the legs out to the side and that area, or you do a split or something like that, and that area gets stretched out. The one you have is probably away from the pubic bone, which is a square bone you can look at to figure out what's going on. And if you've been told, the only issue is sometimes people have a sports hernia and they end up getting surgery for it. It doesn't work because it's not the right type of thing to do. So the sports hernias I can fix, no promise, but I work on them all the time and most of them get better. And the inguinal hernias I cannot. There was a doctor in the 1800s named, he was a French doctor named Perret, and he used regenerative medicine to heal those, but it's not the best way to do it. So surgery is the best way because you get a tighter fit surgically than you do by just injecting it. And the thing that I've been told to be wary of, because I've had patients come in with inguinal hernia repairs using mesh, and they've had terrible results. Yeah, the mesh repairs I think they're having problems with them, and there's a lot of lawsuits about them. So I don't know what to tell you about that. I don't do that surgery, and it's something you have to, get second and third and fourth opinions on before you go ahead and do it to see the right way to do it.
Okay.
Never let a doctor talk you into doing any procedure. Make sure you get all of the informed consent by seeing multiple doctors.
Okay. Well, your words are a great comfort to me, and the knowledge that you supplied along, with your suggestions. So I just really appreciate it, Dr. Darrow, and I knew I'm just sorry you can't help me, but I'm scared to death of that mesh. I really do not want to get that put in there because it's just too high a likelihood that there could be problems with that.
Well, that's what I've been told also, Michael. God bless you and good luck with your healing.
Thank you so much.
Thanks for your call, Michael. Our number is 866-870-5752. Here at the station, you can speak with Dr. Darrow. And remember that free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Just call the show, and you get the book automatically. Again, our number is 866-870-5752. And we finally have Janet back with us in San Jose.
And
Hello.
Janet, thank you for coming back on. Dennis will be with you in a minute. So, Janet, you had something else that you wanted to tell us. What was it?
I did. I also, as I mentioned, I have an L3 to L5 delayed fusion going on. And
Yes.
Earlier on, about 6 months ago, it's been a year since the surgery, and I've had this ongoing pressure and weakness on the left side. And then they discovered that the screws in L5 were very slightly loose, and they felt that my body can tighten. My body will. A fusion is your body making bone, right, with the hardware.
Yes. Yes.
And so I'm waiting for this to. I'm about to have some new scans done, and I was just curious if this is something. If I go on and I have problems, is this something you can treat?
Well, the issue is this. Is it the fusion that's causing the pain, or is it something else going on? I would have to touch your back to give you the answer.
Okay.
It takes me literally 10 seconds, and I can tell you if I can help you or not. A lot of people have failed back surgeries. It's really common. I'm going to say about half the people who get back surgeries or neck surgeries, it doesn't work out the way they expected. And you're one of them. The fact that it hasn't fused over a year means it's probably not going to. That's a long time. Okay? I did a study on low back surgeries when I was in medical school. It was a giant study, and it was about 100 patients who had fusions done, and about half of them, the fusions did not take, just like yours.
Well, they say L3 to 4 is fused, and L4 to 5 is still not quite complete, but they also said it can take 1 to 2 years to complete, and that's a long time to have.
See, the issue is it the fusion, the lack of the fusion that's causing the pain, or is it something else? There's an assumption in your statement that it's the lack of the complete fusion. And I always go beyond assumptions, and I use my hands to find out. And unfortunately, from my experience, most surgeons don't use their hands. They look at scans to tell you what's going on. MRI, X-ray, CT, probably CT in your case because they're looking at bone. And I don't find that's real accurate. I'm sorry, doctors who are listening. I just don't find it's very accurate. It's the old school of medicine, the traditional school. And doctors need to get their hands on the patients and do a better examination. And no examination is the worst kind of examination. Did anybody touch your back? Did any of your doctors actually touch it to see where the pain is being generated from?
I don't recall that they did.
No,
I think it was
they don't.
mostly the scans. Yeah,
you don't do work based on scans. Ever. They're good information. You don't need to have a fusion to be pain-free.
Okay.
See, I'm telling you, the assumption is wrong.
So what you're saying is if I come in to see you and you can touch my back and examine me, there's a chance you might be able to help me with stem cell?
Yes.
Okay.
I'm not promising you anything. People say, "Why aren't you my cheerleader?" I'm not here to be a cheerleader.
No,
I'm
you're
do
not.
The best I can, the best I can, in telling you my experience, which is my truth. It's not everybody's truths, but it's my truth, and I'm not here to give a lot of false hope either. I'm just telling you what my truth is. If I touch the area, and an area I think I can make better, I will tell you, and at the same time, I'm going to go, and I'm not going to promise you anything.
Is there any truth to what they say when they say if the bones should fuse in relatively around 3 to 4 months, and if it takes a lot longer than that, that's when the hardware can loosen a little bit if the bones are too slow in fusing. Is that a true statement?
Well, number one, hardware is generally not going to loosen up. Mm-hmm. What they may have done is taken some of your iliac crest or your pelvis or something like that and put that around the fusion so that you'd have a bony fusion also. I don't know what they did. I'd have to see the operative report.
I see.
But so, the answer to the question is yes. If you haven't had a complete fusion by about 3 or 4 months, you probably won't.
Okay.
And you get what we call a pseudo fusion. You get like a cartilaginous growth of tissue there, which is not bone.
Huh.
It's too soft to hold it.
Well, how do you function that way? How do you live that way?
You see, you keep going back to your old assumption, and I'm trying to take it away from you.
Okay, I'm sorry. Okay.
Do you get what I'm saying there? That it may not have to do with your fusion, that there's a problem.
Mm-hmm. Okay. So it's a matter of investigating.
We need to do Sherlock Holmes as a doctor. Yeah.
Okay. I'll come down with my wrist, my torn rotator cuff on my shoulder, and my low back. I'm quite a case.
Yeah. Yeah, the shoulder sounds like a real easy case.
Mm-hmm.
Partial tear of rotator cuff tendon means absolutely nothing to me.
And what about
treat those every day, and they get better. A what?
Oh yeah. It's also got possibly a tear in the bicep tendon. Is that doable as well?
Yes.
Well, that sounds wonderful. I so appreciate your taking time with me, Dr. Darrow.
And again, I have to be super, super honest with you and upfront. I don't know if I can help you.
Yes.
I've got to touch the area with my hands, see if I can find the pain generator, and then we can talk together about what to do about it. Okay.
It sounds good. I so appreciate your taking time with me.
And for everybody who comes in the office, they often say, I know you don't like MRIs or X-rays. No, that's not true. I like them. They're just not necessarily going to show me where the pain is being generated from.
Uh-huh.
And I need to use my hands to do that. And I still want to see them.
That's my next question.
we found cancers and things like that with MRIs. So
wow.
Not that that's frequent, but yeah, I like to see what's going on in there.
So
I also use an ultrasound. Yeah, bring in at least the report, so we can see what it looks like.
Okay. And I should call your office to set this up?
Yeah, there's people by the phones. It's 800-300-9300. Okay. I'll repeat it for other people, 800-300-9300. And, Janet, I'm sorry you're going through all this stuff, but hopefully we can help you out. It's possible that all of these things can be helped, your wrist, your back, and your shoulder, by using regenerative medicine, your platelets, your stem cells. Okay?
Thank you so much. Thank you for your time. You're great.
God bless you.
I appreciate everything.
Thanks, Janet.
You're great, too.
Take care. Our number is 866-870-5752 right here in the studio. You can call and speak to Dr. Darrow, and you can get that free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Think about what that means, regenerate, don't operate. And we're going to go to Dennis in Redondo.
All right, Dennis, Dr. Marc Darrow. Yolanda, you're after Dennis. Hang with us. Don't go away. Dennis, how are you today?
I'm doing great. Can you hear me all right?
Oh, yeah, you're good. I understand that your fingers and your shoulders bother you. Which is worse?
The fingers in daily use. What I've noticed is the ring finger on my right hand, the middle knuckle, will stick. In other words, if I make a fist and try to open my fist, it
Yep.
that third finger snaps, or sometimes it won't open until I force it. And that's relatively new. That's just a recent thing, maybe in the last month. But I'm starting to feel some soreness on the other hand and stiffness. I don't have the strength of grip that I had maybe 2 months ago. So I was hoping there's a way to cut this off at the pass to lessen this before it got to be a serious problem. You know what I'm saying? Kind of beat it to the punch.
There's a couple things that come to mind on that middle finger. One is called a trigger finger, and you can look that up on Google. It's a tendon it's a tendon getting stuck at what they call the A1 pulley in the hand, and that may be it. It also may be arthritis. They both can look a little bit alike. So that's one I'd have to touch and watch and see what happens to create the problem. And are you someone who works quite a bit with your hands?
Not as much as I used to. I'm on the computer now, part-time during the day. General manual things. I sail, I play tennis, but I don't put a lot of strain. I do manipulate, use my hands continually.
Okay. So number one is you do a lot of strain with your hands. If you're a sailor, you do a lot of strain with your hands.
Okay.
You know, you're fighting against the wind constantly. And you've got ropes and cleaning and all kinds of stuff. You're just not thinking of it as strain because it's normal for you. So you're going to have to give me your boat, and then your finger pain will go away. Nita, come on.
I'm listening. I'm right here.
You're supposed to laugh.
Can I just switch topics into the shoulders for a minute?
Yeah, of course.
I'll tell you what happened there. I started, by the way, I'm 72, but I'm in good shape. I would probably pass for at least a 60-year-old. Anyway, I'm active, but
I'm 72, and I can pass for a 90-year-old.
I thought you were going to say a 17-year-old. You always say 17.
I try. No, I say 16.
Well,
all right. So what's up with the shoulder?
Well, I wanted to get in better shape, and it wasn't specifically for shoulders. I just wanted to lose some weight, improve my strength. So in January, I joined a fitness center, actually as part of a Silver Sneakers program. But I did have a personal trainer, and I think we overdid it on the shoulders. He had me doing a lot of medicine ball, push-ups, military press. So it seems, and I started questioning, I said, well, can we do something besides shoulders? I mean, it seems like, I think he was a rather new trainer. But we continually worked them, and they started getting sore. And now we're in October. Well, I worked out from January through March and then stopped going to the gym because of COVID. And I still have soreness in my shoulders, like right directly behind my deltoids. My shoulders don't click or anything, but I'm very weak trying to raise something over my head. Very weak. Okay.
So here's number one. Get a different trainer, because that guy did too much for you. And you don't take a 72-year-old person, even though you and I are in amazing shape. If I'm wearing a hat and cover my face, I look very young. Come on, Nita.
I think it's true. What's to laugh? It is true. You do look young.
That's a good one.
But, you got it, Dennis, let's face it. You got 72,000 miles on the car, and you don't drive it the way you did when it was a brand new car. Doesn't mean you shouldn't be working out all the time, but you've got to be judicious about it. And I don't think there's anything wrong with your shoulders, and I think that maybe a little rest may help. If not, I think what we do, regenerating the tissue, could certainly help. I think some injections of PRP, platelet-rich plasma, would probably fix them up like brand new.
Yeah, that sounds reasonable. That's what I've been trying to do. Rest. I don't even try a push-up or two. Well, maybe I will one or two, but I don't try to push it. more than that, no pun intended. I just trying to take it easier. But now my fitness level's gone down. I put some pounds on again. I guess I should try different.
Well, I'm just going to mention the putting the pounds back on again. At our age, we don't lose weight by exercising. We're too busy, and we can't work out as hard as we used to. So there's one way to do it. And this is for everybody. I don't care what age you are. Cut out the carbs. It's easy.
Okay.
That's it. Bottom line. Cut out the carbs, and you'll lose. For a man, you'll probably lose 7 pounds the first week and about 5 pounds every week thereafter. For a woman, probably 5 pounds the first week and 3 pounds thereafter. Just cut out the carbs. Easy. And you'll be skinny.
Okay. Okay. That's great advice.
Anyway, I think I can help. I think I can help your shoulders. If you've already cut out the activities and they're not getting better, maybe it's time for you to do some regenerative medicine on them. Your platelets would probably heal those. If I think it's bad, we'd add some stem cells to it. But it sounds like it's not that bad.
Right. That's why I want to catch it before it got worse. And
so let's say goodbye to you right now, Dennis, and tell you we love you, and get on to Yolanda before the end of the show because she's got some neck pain.
Okay, Yolanda, you're on.
Okay. Hi, Dr. Darrow. This is Yolanda.
Hi, Yolanda. How
are you, Doctor? I have several complaints. I suffer from chronic neck pain and throat and shoulder and head pain. So it's different parts of the body. I've just been in chronic pain. Medication hasn't really helped. It's been going on for at least 8 years, I want to say. And my doctor said, well, you just have to learn to live with pain. But I don't. I don't like when doctors tell people they have to live with something. That just means the doctor doesn't know how to heal it. So I don't think I've ever once in my career told someone you got to live with it. I certainly hope I haven't. If I have, I'll slap myself in the face.
I'll help you.
Yeah. Thanks for volunteering.
But anyway, necks usually heal pretty easily. The shoulders usually heal pretty easily, depending what's going on. And I would have to examine you. I'd have to touch your neck. I can tell you, in a minute or so, what's going on, and then we can go from there. Yeah. Same thing with your shoulder. I think you also mentioned your throat. Did you say your throat hurts?
The throat is my main concern now because it's been a few years with the reflux. And I kept telling the doctors, well, the medication wasn't really helping.
Yolanda, I don't know if you're on a Bluetooth, but you're fading in and out.
Oh, okay. I spoke to my doctor regarding reflux, and they...
Nita, can you hear what she's saying? I can't hear.
I'm sorry, Yolanda, you're coming through a little bit too muffled, and I'm so sorry we're out
Yolanda,
of time.
go to my website, please. You can email me there at www.lastemcells.com. There's a spot to email me on every page, and I will answer you right away.
Thank you, Dr. Darrow, and thank you, Alex and Suzette in production. And grab a pen or a pencil, write down this information. Listen to our friend from 11 to 1 Saturdays for the Pet Show. That's Warren Eckstein, and I'm your host, Nita Valens. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.